So I'm here with Dr. Fayez Safadi, my friend and colleague at the Research Institute, who also has a faculty appointment at NeoMed. So I am going to ask you if you would tell us a little bit about what you do here at Children's, as well as your appointments at NeoMed, and then we'll go into your background a little bit.
Thank you, Dr. Forbes, for the introduction. So, as I mentioned, I'm a faculty member at Northeast Ohio Medical University in the College of Medicine, and also I'm a senior scientist at the Research Institute in Akron Children. And my work, based on my training as a PhD, all basically basic translational, and we do clinical research. Ultimately, we are interested to identify solution for unmet medical needs in adult and very much interest in kids conditions. And my relationship between Akron Children and NeoMed, it's been around for over 10 years. Yeah. Very tight connection in multiple ways at the educational level, at the research, and recently in the last 4 years been on innovation and entrepreneurship. So, and I feel very strong, well connected between both institutions, and it's a great marriage, if you like, between NeoMed and Akron Children. And strategically, the hospital is in an area which is really an important for all scientists like me and others to connect and do what we want to do best for the sake of those young kids.
Yeah, terrific. Tell us a little bit about how you became a scientist. What got you going into this?
Great question. In my job, where I teach, I work with a lot of medical students and work with residents and fellows and so forth. I get that question, why you didn't become a physician? And I said, you know what, I admire all my friends and colleagues are physicians, but I have a tendency not to be in a routine level, right? So I like every day to do different things and work on different things. So I decided to take the route of a scientist. So I'm trained in England, my bachelor degree in biomedical sciences and a PhD in endocrinology and genetics, University of Southampton. And I got the, what we call it, the strict British curriculum, if you like, in terms of training. So, but I never regret it.
Tell us Americans about what that means.
Well, it's a very interesting question. As I remember as a student, it's a different mindset when a professor enters the classroom, the door is shut and nobody allowed to enter afterwards. So it's a very strict environment. And when I came to the US, I thought I came with that tight mentality. And I was told shortly after by the chairman, who was a colleague of mine, he said, you know what, we are in the US, maybe you need to chill out a little bit about being strict when it comes to things away. However, it's a great things I learned, you know, from an environment that's, you know, very strong in education and research. But I have to admit, joined the US a while ago. I came to the US in 1996. I was recruited to University of Pennsylvania, where I did my research fellowship in endocrinology genetics. And from that point, I started getting interest in musculoskeletal diseases. And I have to admit, all my success goes to all my mentors, and people might be surprised, all my mentors are MDs, none of them PhDs. So, and that really gave me a wonderful link between what I'm trained as a basic scientist, what we focus. So the training I've received, it's absolutely outstanding, never forget it. And it's a great, you know, relationship when you understand from the clinician the issues and the healthcare issues they're trying to deal on a daily basis, treating kids and others. And we are here to go as a scientist on a bench, try to come up with a solution for what they see on a daily basis.
So that bench to bedside idea started early. Tell me a little bit more about the endocrine genetics that you looked into and how you were able to translate that to the bedside.
When I did my PhD in endocrinology genetics, surprise, surprise, I focused on breast cancer, which I don't do breast cancer or research. And at that time when I was a PhD student, we put a lot of focus on vitamin D. And vitamin D now, it's being used for treatment of multiple cancer conditions. And worked with the group. Actually, even when I was a PhD student, I had to collaborate with the pharmaceutical industry who come up with the new targets, better than vitamin D, don't cause hypercalcemia and things like that. And then when I came to the US, I was extremely lucky because I worked with the best physician ever. known and worked with vitamin D, who was named John Haddad. So he was an endocrinologist. He was the VP for research at TU Penn when I joined his lab, and he's focused on vitamin D and metabolism and musculoskeletal. So I was thrown in that environment, which is fabulous, worked with people. What I learned from the vitamin D aspect, now focus it on the skeletal system. And I start to look at the endocrine and hormonal effect on skeletal metabolism and so forth.
So your training model really is coming into view for me now. I really see the path of how you did what you did. Sure. So you interacted a lot with physicians who obviously influenced you in your basic thinking and translational thinking. Talk a little bit more about that journey and how you've continued to move in that space.
So after I finished my training, unfortunately, my mentor passed away at a young age, and I was the last trainee in his career. However, for a short period of time being training under him, his legacy helped my career. Yeah. So I'm very, very fortunate person in that regards. And I moved after UPenn, went to Temple Med School in Philadelphia, where I started my career path. So I was the co-founder of the Musculoskeletal Research Group at Temple. And again, to have a very robust research environment, you cannot do it with the PhDs only. So we created a group, an environment which basically over 100 staff between orthopedic surgeon, endocrinologist, pediatric who take care of kids with bone diseases, epidemiologists, all the way to physical therapists, you name it, capture the whole musculoskeletal. And I have to say it was a great accomplishment to the point we were ranked outstanding by NIH for our group. And as I mentioned, we were close to 100 and we raised funding probably $6-7 million a year only to support this research environment. So I felt, the best accomplished way to do what you want to do as a basic scientist, you have to have a cohort of people who basically really give you a perspective from a different angle.
Interprofessional education.
And I tell you could not do it better. And 2011, recruited to Neomed. And then my job was actually, in addition to run your research program and help musculoskeletal, is to be the key connector with orthopedic surgeon in the region. Yes. How to work again with a clinician. And I have to say, never regret it for any day, because it's been absolutely an outstanding experience working. And then shortly after, I was connected with Akron Children after I joined 2011. And it's been outstanding experience working with people here.
Share a little bit with the folks watching or listening about what you're currently doing with physician scientists here at Children's.
Despite the fact to train in musculoskeletal research, I always, whenever I connect with physicians, I always tell them, your research might have something to do with the bone at the end of the day, right?
I feel like every scientist feels that way. I remember one of my ID doctors used to tell me that everything is caused by an infection. Right? It's like, okay, I think they may be right there.
And so I work with the wide cohort with individuals from a different discipline. So I work with pediatric orthopedic, pediatric hematologist, oncologist, nephrologist, anesthesiologist, so a wide, and a neurologist as well. So I work with a variety with individual. And the way we do it, we come to the physician and understand what is the unmet medical needs. There are probably a solution to a problem that's not very effective, or as we know, costs incredible amount of dollar for healthcare. So we here coming in and say, can we find it a better solution or a new solution for a problem that lacks any solution? And I have to say the relationship, it's been absolutely outstanding in multiple ways. I get educated by the clinician about the detailed healthcare issues we're not aware of. We don't see them. We always consider ourselves fortunate, with our kids or healthy families and things like that. But when you see what the real world out there, so it's been great not working with the clinician and working with the fellows. And actually, the also wonderful connection is our medical student. So medical student is a perfect connection between what we do at Neomed and here in Akron Children. And it's been very, very rewarding in multiple ways. We were able to attract grant funding, awards. Matter of fact, we work on a couple of patents now because we started emerging the innovation and entrepreneurship in that regards. And one thing I have to say, maybe being selfish, one of the real interests to me, in addition to orthopedic, rare diseases in kids.
Tell me more about that.
So I'm very passionate about rare disease and identifying a solution. So we work with two rare diseases in kids. And it's funny, one of those rare diseases was introduced to me by a doctor at Akron Children. Yeah. Hematologist, oncologist, telling me about rare diseases with lymphatic anomalies in kids. And those kids, when they have lymphatic issues, unfortunately lead to skeletal abnormalities. Right away, the bulb went on me, and I said, wait a second, there is a bone involved here.
Yeah, really a bone problem.
Yeah, that's right. Yeah. And I've been very, very heavily involved. To the matter of fact, we've been awarded grants fellowship to identify the treatment for such a condition.
What is the condition?
It's lymphatic anomalies, which will happen, a complex lymphatic anomaly condition where kids basically have a mutation only in lymphatic endothelial cells. Everywhere in the body, genetics looks normal, except lymphatic endothelial cells. They overexpress a certain molecules, protein, and that leads to the overproliferation, overmigration of those lymphatic vessels like a tumor. They wrap the bone and they dissolve it. And it's another term of it's called bone vanishing disease. Very, very devastating. No cure for that condition. It's only certain medication to subside side effect and things like that. So being very honored to say that only recently we identify a target for that rare disease, which we think could be a diagnostic tool as well as therapeutic.
That's awesome.
So we are very excited to take these to the next level.
That's super exciting. So tell the folks again watching or listening, why study rare diseases? That's not a common condition. Most people have never heard of vanishing bone disease.
It's a great question. It's an unfortunate on one hand when people don't put a lot of effort on rare diseases, in my opinion. Mm-hmm. On another hand, yes, it's rare, but there is no solution and treatment for those kids. And I think it's very devastating to see a cohort of individual, yes, low in number, but nobody spending an effort to find a treatment for them. So I felt myself and my group, if we can be part of those group who identify a treatment for those kids and change their life to the better. And I think it's really an important thing. And another thing.
So you feel, if I'm hearing you, you're saying you feel duty bound.
Absolutely.
Because I mean, for those kids, and again, I'm obviously biased like you are. It's not a rare disease.
Yes.
Right? To that family and to that child, this is not rare at all. This is every day.
You're absolutely right. I mean, yes, we call it rare, but for those kids, that's what they live with. And so basically we feel like it's our duties, as you mentioned, it's our responsibility to identify a solution to help those people. And what made us more into it actually is the connection with the advocacy group. So we were well connected with families, we interviewed children who have those conditions. So we tried to understand the whole aspect. How do these people live in a daily life? It comes to the point, maybe I shared that with you not long ago, we have an interest now to put together a children's book focusing on rare diseases.
That would be awesome.
That's basically, we want to take it to a different level to enhance awareness, if you like. So,
what else? Who are the other scientists, physician scientists that you're working with here?
We work closely also with pediatric orthopedic. There is absolutely outstanding group here in Akron Children, part of fellowship program in the region. And what we did, we developed a research fellowship for medical students who really want to go into orthopedic. Wow. And those medical students take a year off, work between basic translational research at NeoMed and clinical research at Akron Children Orthopedic. Wow. We have 2 fellows already went through that program. Yes. And I have to say the outcome of that opportunity, it's very clear that those students get awards, they go present their work at national, international conferences, increase their publication records. And people initially, when you start with a new initiative, you always question it, if it's gonna succeed or not. And I see the outcome. We just had 2 days ago the graduation from NeoMed, and 2 of the top students who really went through those programs match orthopedic surgery, one of the top places in the U.S.
Wow. That's winning, right? Congratulations.
Thank you. So I feel awesome. The outcome is working.
Yeah, so. That's really awesome. Tell me a little bit more about you have a lot of passion for medical student education.
Yes.
What are you doing in that space right now?
It's an interesting, you asked me this question. I've trained incredible number of people from all the way, actually we have even middle school students come to the lab, all the way to junior faculty and scientists. I feel it's my responsibility to whatever I learn to pass it along to young generation. And that's the way I was trained by my mentor. And I feel this is an important thing to take things to the next level. And I have to say two things here. Young generation are so eager to learn. They really want to be successful, which just makes perfect sense, but they just need the right mentorship. And I think it takes time and effort, but to do it right, it pays off. At the end. So I'm very passionate, I'm very excited. We've trained incredible number of students every year, and you see them very successful in their career path.
You mentioned when you met with the anesthesiologist, you were asking them about unmet needs and how do you solve the problems that they have. That's like an engineer's lens to me. Engineers are problem solvers at the end of the day. And so I know that you've been involved in the innovation space for the last, many years now. So tell us a little bit more about what you've done around the whole idea of going from the bench to the bedside. Because when a lot of folks hear about translational research, it may mean different things to different people. But where is your energy around this?
Sure. Thank you for the question. What we try, once we know there is an unmet medical need, we step back for a little bit and then we see how can we address it. A scientist on his own or her own is not enough, so we work with a team of individuals, and then depends on the problem we're trying to identify a solution for. Could be a device, could be an app, could be utilized, or could be therapeutics or diagnostic. So we work with a cohort of individuals who are not only physicians. We work with engineers, we work with lawyers, we work with business people, and of course medical physician and medical staff. And the individual who really work and identify the solution are students. So we bring students from multiple entities, and usually they don't sit around one table coming from a different discipline, law, business, engineering, and medicine. We put them together, and it's amazing where those creativity comes together and come up with something very valuable. So we created a program called Neovation Bench to Bedside. We called it Neovation for Northeast Ohio. And I just learned the term Neovations is being trademarked in the US now.
Hey, that's pretty cool.
And it's being registered, so that's something very exciting. I just
really
learned this
cool.
yesterday. And we ran the program for 4 years, and we've trained easily 70 teams of people. Each team tackle one healthcare problem. And the outcome for this is not only identify a solution, they protect their idea, they understand how to protect your invention for a patent, they understand the FDA regulatory concept, how to take things to the market. They look at market analysis. If I can make a product, will I may be able to make a profit? Can I reimburse it from health insurance and so forth? So we train them from a multiple aspect, not only come up with a solution to a healthcare problem, but how to get it into patient. It's much lengthy process than people think.
Sure. But it really gets at the point that we need interdisciplinary solutions, right? And it's not a professional scientist or a physician or an attorney. It's really everyone at the table. Yeah, that is really awesome. So what's next?
What's next for me? It's a difficult question because I have too many nexts, not one.
you get bored easily.
Actually, I wish I can get bored, No, I have a lot of ideas. We want to continue what we're doing and enhance our innovation entrepreneurship program to a larger scale. We're getting a lot of institutions interested to help work with us. But I also want to make sure the work we put in with Akron Children make a difference for the young people. And we want to take it to the next level from multiple ways, from the awareness, all that tiny little children's book, all the way to come up with a treatment for kids. So, and I see it's a great opportunities for us to take it to the next level, all the way from the leadership at Akron Children and NeoMed. And the most important things you mentioned earlier on is the team you work with. It's absolutely our outstanding group we always work with on a daily basis. That's what makes us successful.
Couldn't agree more. Is there anything I forgot to ask you?
Well, I want to mention one thing. I am thankful for all the people who I work with. Very, very fortunate that I learn from multiple people. And I have to say what keep me going every day and drive my car to work are the young generation of students. And the little kids, unfortunately, who are in need and what to try to find a solution to help them and have them, have a better life. And it's been a great opportunity to work, and I hope for the best for all the group here in Akron Children and move it to the next level.
Yeah, I'm excited. I think there's never, ever been a better time to be in healthcare. Absolutely. I was at the Pediatric Academic Society's meeting in Toronto over the weekend, and I was with a number of our residents, and when you go to the poster sessions and you listen to the podium sessions, I was just blown away. I was at one of the, it was a critical care session where a first-year medical student gave a presentation at this national meeting. There's probably 40 people in the room, ICU people. And she hit an absolute home run.
Amazing.
She was talking about a rare disease.
Oh, wow.
And so it was really, but she was so articulate and so clear. And so I had a question about it, because what their group identified is that this rare disease is not static. It actually is progressive, which is a brand new way of thinking about the disease, because I've taken care of these kids and the families almost always say, she was fine and now she's not. And it's like, oh. So now there's proof that this is a progressive disease. But I stood up and asked her a question, but before I asked her a question, I said, I am so inspired by you. Because you read the paper, you watch TV, and you go, oh, what's happening in the world, right? And then you work with medical students and these young people, and you're like, all right, I think we're going to be okay.
That's
right?
wonderful.
And so
Absolutely.
I tell them, you're going to figure this out. So that's what I told them. I tell the residents all the time, your generation will solve this.
That's fantastic.
Right? So, because they can, right? They're so smart, so enthusiastic. So I'm really grateful for your mentorship, what you offer our students and our residents, and we need to clone you, because honestly, I think your investment in the younger generation is very obvious, and it really is very rewarding.
I'm very fortunate to work with a group here.
It's really been terrific. So
Thank you.
Thanks for your time.
Thank you, sir.
Appreciate it.
Thank you.